I am Dr. M. Arunkumar. I am a naturopath and yoga physician. Now I am going to present you about diabetes diagnostic methods. So now we have seen about diabetes. What is diabetes? It is a metabolic disorder in which the blood sugar level is increased. So we have seen about diabetes, and also there is important thing to see, that is pre-diabetes. What is pre-diabetes? It is when the blood sugar level is above normal, but it is not high enough to be diagnosed as diabetes. So what it indicates is the person is at very high risk of diabetes. If he is not properly given treatment, then he will lead to diabetes in the next 10 years along with diabetic complications like strokes and other renal diseases they will lead to. So in this pre-diabetic condition, when we give proper lifestyle management with modest weight reduction and moderate physical activity is increased, then we can prevent diabetes, or at least we can prolong the diabetes for next 10 years. We can postpone the duration of the diabetes. Okay. So there is in this we have to see about 75% of the people are in pre-diabetic stage. This is the ADA, American Diabetes Association's criteria they have given, that 70% are in pre-diabetic stage. Only about 25% are in diabetic stage. So first we have, before going to what test, diabetic test, we have to know for who should be tested for diabetes and pre-diabetes. So when a person comes with symptoms like frequent urination, increased thirst and increased hunger, these are very common symptoms in diabetes, and rest of that, if you have a blurred vision, feeling drowsy, is very tired, always feeling very tired, and very slow healing wounds, and also tingling and pain sensation in the foot and hands. These are the symptoms of diabetes. Other than this, we have some risk factors. We know this what are the symptoms, what now we have seen. This is very common symptoms of diabetes, but also most of the pre-diabetic patients, they are asymptomatic. They will not show their symptoms in the beginning. In the early stage, they don't have any symptoms. So how can we diagnose these pre-diabetic stage? So there are some risk factors which we have to consider. The risk factors for adults, risk factors for pregnant women, and for teenagers and children too. So now we are going to see about these risk factors. So in these risk factors for adults, if an adult over 45 years of age should consider for a diabetic test. If he is having no symptoms at all also, he has to consider. But if the same person above 45 with obesity, it is very strongly recommended for him to go for a diabetic test. This is the adult. And along with, if the person with obesity, along with some other risk factors like family history of diabetes, lack of exercise, and unhealthy eating habits. If he has these kind of unhealthy lifestyles, then it is very strongly recommended to go for diabetics, even if he have no diabetic symptoms, because he will be in a pre-diabetic stage. So what is the importance of pre-diabetic stages? In pre-diabetic stage, we can reverse the condition. So as we have said, so this is the importance of the pre-diabetic stage. And also some other risk factors also is there. That is, as we already have seen, so that is hyperlipidemia, high cholesterol, high blood pressure, irregular lifestyle like smoking and drinking, and sedentary lifestyle. And also, if a pregnant woman gives birth for a baby which is more than 4 kilograms, then she has a very high risk of diabetes. And also, a woman with PCOS, polycystic ovarian syndrome, she also has the high risk of diabetes. Other than this, if the woman has a gestational diabetes and pre-diabetes, already I said pre-diabetes, and history of cardiovascular disease. So these people are at very high risk of diabetes. So we have seen for the adult. The next is children's. Normally we know the type 1 diabetes is a very rare thing in children, but now type 2 diabetes also is now getting very common in children because of low activities. Their activities are becoming very less. So these type 2 diabetes are very commonly, very rapidly increasing in type 2 children. So when the child is obese, then along with other risk factors like sedentary lifestyle, what we have seen before, and unhealthy eating habits, then they have to go for diabetes test. And also important, if the mother has gestational diabetes, when the child was in gestation and the mother had the gestational diabetes, and also race, some like Asians, so they are very prone for diabetes. Those people, those children has to go for diabetes check. Though when this checkup has to be done is from the age of 10. It is recommended from the age of 10 or after the onset of puberty. So for every 3 years once they have to go for diabetic test who have the risk factors. And next, pregnant women. All pregnant women with risk factors like obesity, sedentary lifestyle should go for diabetic test. It is very compulsory now. So also we have to see when it has to be tested. Generally at the first visit of prenatal visit, just when the pregnant woman come for the first visit, it is recommended to test. If she is not having the diabetes, but she has the risk factors, then she has to go for diabetes test between 24 to 28 weeks of pregnancy to check whether she has the diabetes or not. And in case if she is not having the, if she had the diabetes, if she got the diabetes, so after that she got delivered also. So after that, between 6 weeks to 12 weeks, within this period, again she has to go for a diabetic checkup, whether to check where she has a pre-diabetic or she is a diabetes. If she is normal, then for every once in 3 years, she has to go for a regular checkup of diabetes, because she has already had a risk factor of diabetes. So every 3 years, if she is normal also, she has to go for the test. So generally, how are diabetes and pre-diabetes are diagnosed? Generally, two things are followed. Generally, one is blood test, and another is urine test. So these two types of tests are used for diagnosing the diabetes. So this generally what is done is how the test is done is generally blood is in the lab, in a lab the blood is drawn, and it is in the lab we are generally doing the diabetes test. And another thing is we have glucose monitoring instruments, but they are not that much accurate. But it can be used in emergency condition to immediately check the sudden hyperglycemic condition. We can use this kind of thing. So why it has to be done, this blood test? It enables the healthcare providers to diagnose the pre-diabetic stage or the condition of the diabetes. It is very important. Only through blood test we can diagnose the condition, whether it is diabetes or pre-diabetic stage. So this is the blood test used for diagnosis. Commonly we have three kind of blood test, which is very common. This is a preliminary diagnostic method in blood. So one is A1C. It is given in percentage. Another is fasting blood glucose, and the third one is oral glucose tolerance test. So in the A1C, generally it's called A1C or HbA1c. We can have the different name. Generally we say A1C. So in this, the normal range is about 5. That is 5 to 5 points, up to 5.7 it is normal. When it is above from 5.7 to 6.4, we call it as pre-diabetic stage. And above 6.5, it is called diabetes. In plasma fasting glucose, generally what is plasma fasting plasma glucose, preprandial. Generally we call this preprandial. We will be taking in the morning in the empty stomach. That is called fasting plasma glucose. It is below 100 is normal. From 100 to 125 it is called pre-diabetic stage, more than 126, it is called, it is considered as diabetic. And oral glucose tolerance test. This oral glucose tolerance test also we call postprandial, but there is a slight difference is that we will I will give you the information about it later. Generally, it is taken 2 hours after food. Thus, after food we are going to take. This is also called postprandial. This normal level is up to 140. Then, if it is above 140 to 200, it is called pre-diabetic. If it is more than 200, then it is called diabetes. So, now we are going to say about each test now. So, A1C test. That A1C test is generally used to detect type 2 diabetes and pre-diabetes, but it is not recommended for gestational diabetes and type 1 diabetes. So, the reason is this A1C, there is some abnormal results can also occur in the HbA1c. This is because of anemia. So, generally in pregnant women, the anemic condition is more common because this diabetic test mainly involves the saturation of glucose in the hemoglobin. So, there is generally anemic condition, this test will not go. So, generally for type 2 diabetes and pre-diabetic condition, this A1C test is very useful. So, generally what it shows is, it shows the average in the 3 months of period, how the glycemic control is there in our body. It will show the period of 3 months, it is generally. So, as you said, this abnormal results may interfere mainly due to blood disorders like sickle cell anemia, thalassemia or anemia. So, it is not recommended for pregnant women. Now, this fasting plasma glucose test. So, generally we call it as preprandial fasting glucose. So, how it is taken is, generally no food is taken for 8 to 12 hours prior method. This is a traditional method of testing the blood, sugar level. So, generally as you said, it is if it is below 100, it is normal. If 100 to 125, it is pre-diabetics. If more than 126, it is diabetes. So, once or twice this test should be done to confirm that diabetic condition. So, then comes the oral glucose tolerance test. So, in this what we have to do is, after up to 8 hours of fasting, 75 grams of glucose in 300 ml of water will be given, and after that, after 2 hours the test will be performed. So, in this, if it is below 140 milligram, then it is normal. If it is 140 to 200, below 200, it is a pre-diabetic stage. If it is more than 200, it is diabetics. So, in this way, oral glucose tolerance test is diagnosed. It is more convenient for pregnant women. As I said, HbA1c we can't do for a pregnant woman. This test is recommended for that one. So, next is serum fructosamine. This is as before we saw HbA1c. It shows the glycemic index control for 3 months. This one, it shows the glycemic index for 1 to 2 weeks of glycemic index. It is a short span. Glycemic index can be tested tested by this, and it is recommended. It can be by this we can test for a pregnant woman also, because with HbA1c, as I said, due to anemia we can't test it. But with this we are testing from the albumin. So, it is not, there will be no problem, and for pregnant women it is advisable to go with this test. So, the same thing only. So, next is serum insulin or C-peptide. So, already Dr. Mohan sir gave a good account about this. So, generally this test will help to find out whether the patient requires the insulin or not. If this test result will show if there is increased buildup of insulin and also diabetes. So, as the doctor said, insulin resistance may increase the insulin level in the blood. So, this test, serum insulin, also another test, C-peptide test. This will help to identify the increased insulin level, and also if whether the patient requires the insulin or not. It will give the answer for that. And also we have an immunological assay test. This what we call is glutamic acid decarboxylase. So what is the use of this? It will differentiate the type 1 diabetes from type 2 diabetes. This will help in differentiation. It will be absent in type 2 diabetes. It shows the positive result in type 1 diabetes. So what is the importance is, sometimes late onset, slow onset type 1 diabetes can also occur in adult male. After 45 also, sometimes type 1 can also occur. So to differentiate this test is very helpful. It will give the result whether it is of type 1 or type 2. We can differentiate with this immunological assay. And next it comes this is the general blood test what we will be using. Then comes the urine analysis. In this urine analysis, generally we will for blood urinary glucose, generally urine sugar we will say, this is a glycosuria. This is also a very first line of treatment, first line of test in diabetes mellitus. Generally this will occur in urine. You can see the glucose presence only when the plasma glucose rises above 160 to 180 milligram per dl. So generally we have also nowadays we have the dipsticks for this. Dipsticks is a very convenient method of checking the glycosuria, but it is not that much recommended. It can give only a trace of result. Only the lab diagnosis can give you the best results. So generally this glycosuria test is to check whether in urine you can check about the amount of glucose. It is given in the plus 1 plus 2 plus 3 plus, we can see that generally. Generally it is absent. For healthy person, this is absent. So next it comes for ketonuria. So when it comes to complication, we will come about this. The ketoacidosis, already we have touched about it. So ketone bodies will be developing due to lipid metabolism. When the insulin is very low, it can't metabolize the carbohydrates. Because of that, lipid metabolism will happen, and the waste byproducts is ketone bodies. So increase in ketone bodies leads to ketoacidosis. So this one can be seen through urine analysis. So this is a very important for type 1 diabetes. It is very important test because sudden increase in ketoacidosis may lead to even coma and death. So it's very important test. So it is called ketone bodies, ketonuria. So next urine analysis is microalbumin. So microalbumin test is generally it will help in detection of early renal damage. It is very, very important diabetic. This is also a very, very important test in preventing the complication of diabetes. This test will give you the idea about whether there is diabetic nephropathy. So this generally it is below 30 milligram in 24 hours. If it is more than that, then it shows the indication that there is a renal damage is happening. So in the early diagnosis, we can prevent this renal damage. So this is important in diagnosing this part. So all these tests are actually in the urine test. All these we have the dipstick diagnostic things also, which we can use in the home itself. Okay. So and we have seen this urine analysis up to that, and along with that, we have some other criteria which is given by American Diabetic Association to check that's called ABC of diabetes. That means A for A1C, the blood sugar, B for blood pressure, and C for cholesterol. These three things is very important. Along with this test, these three things also is very important. So generally, we have seen that the fasting, this is the criteria of the things. So in the fasting blood sugar, generally it should be below 130. Postprandial, it is below 180, and A1C should be maintained below 7%. So for a healthy, to maintain a healthy, to prevent the diabetic complications. So in hypertension, the blood pressure should be maintained below 130 to 80. It is a normal range. And the cholesterol, generally low density lipoprotein, the bad cholesterol, it should be below 100 milligram. And high density lipoprotein, that is good cholesterol, should be 40 milligram per dl for men and 50 milligram per dl for women, and triglyceride should be lower than 150 milligram per dl. So, these are the general test, generally to test, and rest of this we have some additional test also. These are preliminary test. Before we have what we have to do for the patient, this is a preliminary test. And addition, if once the complication has arrived, this is a preliminary test. And once the complication, according to that, we have to go for thyroid function test, liver function test, renal function test. So, we have different types of tests. So, before what we have seen is a preliminary test for both diabetic and pre-diabetic. Okay. So, do you have any doubts? Okay, thank you.